Worldwide, it is estimated that more than 500 million people are living with diabetes. Around 30% of these patients develop a diabetic neuropathy, where nerve damage usually starts in the feet. 15 renowned experts from all over the world met at an international consensus conference to discuss and develop recommendations on the best practice in screening, diagnosis, and management of diabetic neuropathy in clinical practice.
Diabetic polyneuropathy is the most frequent microvascular complication of diabetes, which is observed in approximately 1/3 of all individuals with diabetes, and perhaps half of these have neuropathic symptoms, including pain, while the other half remains largely asymptomatic. This is one of the reasons for the high rate of undiagnosed neuropathy of up to 80%. Another issue is that the available guidelines on the diagnosis and treatment of diabetic polyneuropathy are either heterogeneous or even confusing or incomplete by focusing only on certain aspects of the condition. And we therefore took a holistic approach to provide consensus recommendations covering all relevant areas and define algorithms for screening, diagnosis, and treatment of polyneuropathy that are relevant specifically for clinical practice based on the available evidence and also on the experts' personal experience where evidence was lacking. One challenge is that half of the patients remain asymptomatic and therefore need to be examined and not only asked for symptoms. Another problem is that different nerve fibers are involved, large fibers, small fibers, so that a single test is usually not sufficient to diagnose the neuropathy. So in many settings, you need a set of tests, but there are many of them and they are not sufficiently standardized, so that the question arises as to which tests are most appropriate. In this regard, the consensus report gives distinct and condensed practical recommendations and algorithms for the physician to be able to decide which tests should be preferred and how exactly they should be used in clinical practice to diagnose the condition as early as possible.
The management of diabetic neuropathy includes 3 cornerstones. First, lifestyle modification, optimal diabetes treatment aimed at near-normal glycemia, and multifactorial cardiovascular risk intervention. Second, pathogenetically oriented pharmacotherapy such as alpha-lipoic acid and benfotiamine. And third, symptomatic treatment of neuropathic pain, including analgesic pharmacotherapy like antidepressants, anticonvulsants, opioids, capsaicin 8% patch and combinations if required, as well as non-pharmacological options.
I think the most important aspect is the holistic approach, considering not only, for example, symptomatic pain treatment, but also including the concept of pathogenetically oriented pharmacotherapy. Another advantage is the use of a structured consensus finding process by applying the Delphi method. Last but not least, we give recommendations owed to the current topic of COVID-19 pandemic against the background of the increased risk of in-hospital mortality, foot complications, and amputations among diabetes patients with COVID-19. So I do hope that these straightforward and distinct recommendations will be helpful for the physician when diagnosing and treating patients with diabetic polyneuropathy in daily clinical routine.
The consensus report is published in the scientific journal Diabetes Research and Clinical Practice and is available online with free access. For more information about the consensus report and information for clinical practice, please visit the FERFAC homepage.